we're going to pivot to automating the automatable. In other words, what are the things that you can automate? And prior to COVID, I would suggest to you that people had an idea of some small things that they could automate. And COVID, by sending everyone home and saying we're going to work from the house for a month and 2 months and 12 months and 14 months, has really opened the aperture on what people now believe they can automate. So we have a nice contrast for you today. Both of our guests today, Lisa from the Department of State, is going to talk to you about serving their internal citizens, if you will, with their desk. And Elvina is going to talk to you from the Maryland Health Exchange, not only about how to help citizens of Maryland, but how their program reached back into the federal government and databases to kind of show you that you don't have to build a siloed solution. When you're building to automate the automatable and you have an automation first mindset, you can think outside of it. So welcome to both of you.
Thank you, Jim.
Sure, glad to have you. And Elvina stepped in today. Her boss has actually been out a little under the weather for a little over a week or so. And she got tapped today saying, guess what? You're going to be a TV star. And she's like, nobody uses the TV anymore. What are you talking about? And oh, okay, a webinar. So we're excited to have her. She's ready to go. Let me ask each of you to take a second to tell our audience about you and your agency and what your mission is. Let's start with Lisa, please.
Sure. Hello, everyone. Good afternoon. I'm with the Department of State. I'm in the Information Resource Management Bureau, supporting the Consolidated Customer Support Office. So we're essentially the IT enterprise service center for the department. We service more than 100,000 employees and contractors of the Department of State. We also support about 35,000 desktop workstations. We refresh about 8,000 of those per year. We cover hundreds of sites as well as nearly 50 bureaus throughout the department. We also, like I said, enterprise IT support. So we're effectively the tier 1 support level for the department. So in our automation journey, we've been looking to identify opportunities to modernize and like our colleagues said previously, look for more opportunity to do high value work, more customer oriented work, and some of those manual processes and manual service request types that we fulfill, why not automate them?
Nice. Thank you. Elvina, how about Maryland? How's that? Of course, it's different because it's the state of Maryland, but what does your organization do and how does it serve the citizens?
So just about myself, I'm Elvina Morris, Director for IT Policy Operations and Quality at Maryland Health Benefit Exchange. Maryland Health Benefit Exchange is the state-based insurance marketplace for Maryland residents and small businesses to explore and compare health coverage options. And it allows them to determine their eligibility for tax subsidies, credits, and also enroll in private and public health insurance plans. We have about 1.2 million Medicaid consumers and more than 160,000 consumers enrolled in private health plans through our exchange. We call our exchange as HBX system, and it consists of various applications. So the backbone of our exchange, we call it consumer portal. We have worker portal, which is used by our call center team and interagency workers to support our customers. We have marketing portal, which assists our marketing team to reach out to our consumers. We have our chatbot, which is an artificial intelligence-based bot solution for assisting our consumers. We call it Flora. We have Enroll MHC, which is our mobile app, and it's attracting more than 60% of our consumer traffic. In addition to this, we have MHC Small Biz for Maryland small businesses to seek health coverage for their employees and families. And also we have an integrated customer relationship management solution based on Salesforce platform, which helps our call center team to provide faster and efficient customer support.
Nice.
So that's a little bit.
Oh, no, that's great. That is really good. So Lisa, let's dig into a little bit to the Department of State. How are you using RPA specifically?
So we have kind of taken about I'd say the past 6 months or so to have a pilot project whereby we identified service request types for at the tier 1 support level that comprised roughly 20% by volume of the tickets we have annually. So these were service request types such as data access requests, data transfers, account disablements, account deletions, user exception requests. So those are instances where, for example, maybe our foreign service personnel are transferring, and so we put their accounts into a hold status so they're not deleted. So services such as those. Now, in doing so, we took a number of weeks as part of this project. It was a very high velocity project. It was about 4 months, 4 30-day sprints. So we were moving very quickly, but we did take that time to do some process discovery, identifying opportunities for small process improvements, given the timeline we were working with. However, what we identified were a number of fulfillment steps along the way that were prime candidates for automation. And so through that discovery, so this was over the shoulder demonstrations from our technicians, our SMEs who do this work all day, every day, and really looking for those refinements, and then figuring out, okay, how might we automate this? Who are our partners within our bureau who can support us? Our systems integration office, our cloud program management office, information assurance, and even our partners in diplomatic security. We all work together to pull this off in such a short amount of time. So there was a lot of collaboration there, and by doing so, we were accessing our ITSM platform, ServiceNow, for example. Active Directory tools were used as part of this automation. So there were integration points along the way, as well as when we were working through the development phase. And then at the point at which we were ready to move to production, we were finding that we were reducing not only the amount of time spent in fulfillment of these services, but also with accuracy as well. And then having a record of the execution of bot logs that were helping us identify, was this done accurately? So with that, we definitely identified some kind of early KPIs, such as capacity gained. So not necessarily looking in terms of dollars saved, but more time saved or person hours saved. And so with enabling these automations, reducing the amount of time spent, average handling time of these services, I found that we were saving about 7,000 hours, person hours per month. And over a course of a year, we could save about 90,000 hours just in these 8 automations that were developed as part of this phase 1 pilot that we took on.
Great. And I don't imagine that those 90,000 hours mean that people get to sit around whittling their thumbs. They're probably overworked already.
Absolutely. As you can imagine, in many cases, not enough resources for as many customers as we support, but also there's that aspect of customer service that just can't be replaced by automation, and that's the people interactions, and really just that high contact, high value support that really helps improve the customer experience. And why not free up our technicians' time to be able to interact more with customers while the manual processes that were taking so long and so laborious being done by an automation?
Yeah, couldn't agree more. So we're going to come back to you in a second. I think you have a video or a demo, which would be great to see. And let's go to Maryland, great state, right on the coastline there. Tell me, Elvina, why RPA or automation at all?
So I think everybody has that question. That's a great question. What I think is, why do we want to do manual tasks which are so repetitive? You're doing it, it is time consuming, it is repetitive. Why not use something that can do the same task and free up your space to do something valuable, and you can provide your knowledge, you can provide your value into something that needs more attention. So we did explore robotic process automation in 2 different areas in our operation sectors, and we did see tremendous improvement by having robotic process automations through UiPath built in there. One was very tedious, time consuming. It had to be done. Also, it was very time sensitive. We have about 1.2 million Medicaid consumers, as I stated earlier. And we do have to send these transactions across multiple state agencies. And by doing that, it is kind of very important that we validate and make sure the identification or the biographic identification of consumers is kept intact. During this process, it required a lot of manual matching, which means which we have in our presentation, which you'll see how the bot goes and does the same task that our EDI analysts would perform for 4 hours a day. So we were able to put automation because it's repetitive. You know the use case, you know the business rule. Once you train the bot to have those use cases, I would say, why not automate?
That sounds good. All right, we're going to come back to you in a second because you've got a video also.
Hi, I'm Alexa. I am an EDI specialist. I am responsible for ensuring Medicaid health insurance enrollments are processed accurately for 1.2 million Marylanders. Before we implemented UiPath robotic process automation into our biographic matching process, my job, along with 4 of my colleagues across state agencies, was to manually match applicants' biographic information such as name, social security number, and other critical information across agency systems. This used to be a daily, mundane, manual process that held up timely processing of data discrepancies across government agencies. It was always a race to clear up queues every day. Let's see how our life changed with the RPA. Here comes our RPA bot we affectionately call the Busy Bee, who helps us match biographic information in Medicaid enrollment transactions. It opens the application, gets into the worker queue, selects the district office in question, opens the case, and intelligently applies a complex set of rules to match the records. Over time, Busy Bee has become very smart. It handles more than 90% of biographic matching cases every day with a matching accuracy of 99%. So far, Busy Bee has processed over 125,000 transactions, eliminating 5,000 hours of manual effort. More importantly, our analysts are now able to focus on different tasks, addressing complex consumer cases and achieving reduced wait times for consumers requiring critical health coverage. Also, Busy Bee helps in other areas, validating qualified health plan enrollment transactions for more than 160,000 consumers. The task of reviewing the enrollment transaction files, correcting data issues, and sending files to insurance carriers is totally automated. Busy Bee has eliminated the manual intervention in the file processing of more than 95% of such transactions. Because of this automation, we are now able to process consumer enrollments 3 times a day, and in the near future, heading for real-time enrollment and automating consumer document validations facilitated by RPA. As you can see, through automation, we are able to achieve improved operational efficiency and deliver better consumer experience for Marylanders. Our technology strategy for RPA is simple. Expand utilization of bots enterprise-wide across MHBE's core operations. Fully automated government is not a cliche. It's a requirement for government organizations to provide next-level service to citizens.
Also, so Lisa, could we take some time, because everybody wants to see the homecoming king and queen, a bot working, and hear why and how are you using it? So let's look at that if we could.
This demonstration is for an automation called Testing of OpenNet Systems. This automation is used by the Department of State in the Consolidated Customer Support Office to support image and applications testing of desktop workstation images. So after a system update, an analyst will log into each workstation and follow a series of prescribed tests, which are designed to ensure that computers still function as expected post-update. The results of these tests are then provided to our Enterprise Network Management Office. So at the beginning of the bot's execution process, the bot will begin once the user opens an instance of the remote desktop protocol and connects to the computer they wish to test using their administrative POV card and credentials. The user then does a couple of quick verifications, for example, just verifying the login screen appears and that the Windows 10 disclaimer appears, and then the user then begins executing the bot, which begins by verifying that certain things open upon startup, such as a command prompt, and then PowerShell, and then a verification of user account configuration, followed by a verification of system information, registries, Windows features, and then a verification of the expected list of updates to the computer. There's a verification of power settings as well as the applied group policies. Then the bot goes into a verification of application functionality, and there's a list of applications that it verifies, such as Word, PowerPoint, Excel, Calculator, Microsoft Paint, sticky notes, and so on. There's a verification of the version of Office being used in addition to any add-ons for Internet Explorer, Edge, Chrome, and so on. There's also a verification of all of the settings for group policies as well as security settings. There's a verification of devices and registry settings, followed by an output report that the bot creates in an Excel spreadsheet. And then this is then saved to a defined folder within a shared drive. And then that is essentially the end of the bot's execution process.
And Lisa, that's not a simple. A lot of times someone will say, oh, we've had automation for years, Jim, and it's really a macro. This isn't a macro, right? This is truly emulating your staff.
Correct. And when this use case was first presented to me and I saw the actual manual process of conducting these image verifications, it was literally a spreadsheet with multiple workbooks, and there were just dozens of lines where they were manually one by one verifying this, not only on one desktop example, but for every model of desktop workstations that we had out there. So this was very, very time consuming, took dozens of hours per week, and at least 2 testers doing this work. So you can imagine the time saved now is just as that was done in a matter of 2-3 minutes. So a drastic time savings.
Perfect. So let's contrast that now with Alvina, you and the health services in Maryland. What is your automation going to do for us?
So the robotic process automations that we built, we had 2 use cases. One, I will talk about the second use case because I briefly touched on the first before. For our consumers who enroll in private health plans, we send enrollments to our carriers daily, and it requires a lot of analysts to validate the file to make sure the data standards have been met, the data integrity is there, and also to make sure we do not get a lot of errors, rejections from carriers. So we did explore robotic process automation, again, those processes into validation of those files, which again serves about 160,000 plus consumers who are enrolled in private health plans. So we do have about 5,000 transactions on a very busy day where we have to validate, make sure the data integrity is met. So having RPA implemented, we not only met all the data standards, we saw a significant reduction of data errors as well as the external rejections from carriers. Not only that, we were able to get to close to real-time enrollments instead of having the files being sent on a daily basis and a little bit of lag time for consumers to be enrolled. We were able to have the enrollments in the carrier system within hours from the time when the consumers would enroll in our system. So that is what we were able to achieve with automation on one of our use cases.
Nice. So tell me, Lisa, where are you going with your automation program in the next 12, 18 months?
Well, I can speak personally in that I'm moving toward a phase 2 of the project. I'm eager to begin automating a number of our account services that we perform, such as transfers and kind of expanding upon our earlier automations, doing some enhancements there, making them a bit more robust and comprehensive along the service delivery line. So that's planned out in about the next 3 to 6 months is to stand that project up. And then I'm working with our partners over in our systems integration area to stand up a center of excellence, if you will, and get more of a governance and structure around our various projects that were automation projects throughout the department. It's because it's definitely emerging as a service and a technology that we're eager to implement.
Oh, nice. So you didn't, so some agencies don't start till they have a COE. You actually have started and you're going to blend in with a COE. Is that your plan?
We're blazing a trail, if you will.
There's nothing wrong with that. Somebody's got to go west. So good. And Elvina, tell us, the citizens of Maryland, how are they going to continue to benefit not only in health services, but what are your plans for automation going forward?
So one of the key IT strategy is, and the goal of our agency itself is to get faster enrollments, get most of the residents of Maryland enrolled in health coverage. So by having RPA processes built, and one of the key initiatives that we are looking at the near future is to have the RPA verify and validate the documents that the consumer provides for their verifications. By doing that, we are actually starting to look at about 500 documents on a daily basis that we can have UiPath verify and validate instead of a worker going and manually getting the document, reading through it, and looking at what they have attested and comparing, and then verifying the document. We are trying to build those use cases in RPA and have the bot do it for them. That reduces the time that the consumers have to wait for the worker to verify the document to be enrolled. It also frees up the worker time. They do get to focus on more complex case resolutions, and they can provide a better value to Marylanders.
Very good. And let me ask one quick closing question to both of you. It's kind of out of the blue. Are you retraining and reskilling your staff? Are you bringing in outside contract staff, or do you have a plan for kind of a hybrid so that your staff has a place in the future? What, Lisa, what yours right now? What's DOS doing?
I'd say it's a hybrid approach. Certainly, bringing in our technical services, contract support to have that key development expertise and really know how to deploy automations. However, there's always that necessity to have the internal folks getting up to speed on the processes and sort of the methodologies that we're applying. Not only that, but supporting the process discovery as we seek to automate the work we do.
Thanks. And what about Maryland?
I would say it's a hybrid, but we look at building expertise within our internal team, and our team has time and again stepped up and they have taken up challenges. So we kind of encourage our internal team to build up expertise, and that's what we have done with RPA, where we have a hybrid model, but again, the internal team has stepped up and they have been able to achieve the automation that we were looking for.
I think that's a great way to get buy-in from your employees to make sure they're part of the journey and they're not watching it on the side wondering. So good. So thank you, ladies, both of you for time. We're gonna wrap up here real quick, but automating the automatable when you're doing health things for the citizens of Maryland and you're helping our diplomatic corps across the globe. I mean, that and the things that you've automated are not little simple A equals B, yes or no. They're complex things to do, but they're done easier, I think, with automation and AI and machine learning and of course with the UiPath bot. So thank you for your time today. I really appreciate your efforts and look forward to hearing more about your stories going forward.
Thank you.
Thanks,
It's been a
Jim.
pleasure.
Thanks.